Hello, everyone. Welcome to the July monthly meeting of the Youth Medical Career Exploration Organization. Today, I have the honor of meeting with Anthony Machuca, a medical dosimetrist at Mount Sinai Hospital who plays a key role in designing radiation treatment plans used in radiation therapy. So, thank you, Anthony, for joining us today.
Thank you. It's so excited to be here. I'm very excited to talk to you about medical dosimetry and what this profession is, kind of dive in a little bit more as to who a medical dosimetrists are and what they look like in clinic. So, what is medical dosimetry? If you do a simple Google search, you might get something like this, where it says that the medical dosimetry field involves the measurement of calculation and design of radiation treatment plans for patients with cancer. These are used to treat various tumors and other conditions. So, at our core, we are treatment planners. We are people who use these specialized machines with high energy beams to radiate cancer cells and hopefully shrink them or completely eradicate disease and increase patient outcome. So, who is the medical dosimetrist? The medical dosimetrist is a member of the radiation oncology team who works closely in collaboration with radiation therapists, medical physicists, and radiation oncologists. They use their knowledge of physics, anatomy, and radiobiology to develop an optimal treatment plan. This will usually minimize dose to normal tissues while applying a prescribed dose to the disease target volume. So it starts from the top, where our radiation oncologist meets with the patient and they'll prescribe them a prescription. We work then with the radiation therapist to obtain a CT scan, and we use that scan to then plan on, and that's what we apply the target dose to. So our job is to make sure that we get that prescribed dose exactly where it needs to be while trying to spare everything else. And everyone on this team works together to kind of make sure that we're doing that safely and effectively for the patient. What skills are needed to become a medical dosimetrist? Well, you need a knowledge of anatomy, physiology, clinical oncology, radiobiology, and radiation physics, an understanding of the technical aspects of radiation oncology and medical physics. You also need competency in navigating various software and programs. You need good oral and written communication skills, excellent analytical skills, and problem solving skills. You need to work well with the radiation safety team and regulations, and you need skills to interpret and execute treatment plans as defined relevant treatment protocols. You need to visualize three-dimensional concepts for the portion of treatment planning. So if I can kind of dive in on each of these bullet points a little bit more, a lot of our education in medical dosimetry school or in a program based is on these four pillars or these classes. We need to know anatomy. We're looking at CT scans every day. And we also can import other modalities like PET and MR. So these are other ways to visualize the human body. So having an understanding of what it looks like and figuring out where you are is super important in treatment planning. Clinical oncology, we work together with rad-oncs, med-oncs, and surgical oncologists in treatment planning. So it's not just a specific, some patients don't just get one specific treatment. It might be a combination of the two, or you might get chemo first and then radiation. You might get radiation first and then surgery because we'll try to shrink the tumor. So you need to have a working understanding of how cancer works in the body. How can we best kind of get the patient to a place where they feel comfortable and make sure that they live a good life. Radiobiology, that's kind of the study of the effect of radiation on the body. So why are prescriptions a certain length? Why can't we just go higher if it's a more aggressive type of tumor? These are things this class kind of helps you understand why that is and kind of how to do it safely. Because the one thing about radiation that I was always taught is you can always give more, but you can't take back. Once you admit that into the patient, you've kind of let that go. So it's very, very important for you to understand what the effect of how you're using the tools to get the effect that you want. And in that same plane, radiation physics. So what are we doing in engineering? How is this working in the body? How is this working with other cells? What are other ions that we could be using? This is kind of really where radiation oncology is moving forward, and that's where the edge of it is. We're discovering new ways to treat and new ways to use radiation to really combat cancer in a way I think we've never seen before. When we look at the programs that we use everything from CT software to gather that image data to our planning software, which is where we get to choose different angles and different arcs and different beam geometries. And that's really our domain, I think, as medical dosimetrists. That's our software where we can really figure out how we can get the most tailored and perfect plan for this patient given their position at simulation. And when you want to think about this in 3D, what that means is that if you think about an X-ray, it's just one plane, one slice. But a CT kind of combines a bunch of X-rays together, and it gives you a 3D volume. So if we were talking about, let's say someone has prostate cancer, there are other things surrounding that. So you can't just think about what's on one plane. There might be something right above it that may not be able to withstand that radiation dose. So you kind of have to carve that dose and make sure that your treatment plan is safe but still effective. So, what are our tasks? What does this look like in clinic? First and foremost, we are treatment planners. We develop precise radiation plans to target cancerous tissues while minimizing exposure to healthy tissues. This is key, and I feel like you're going to hear this many, many times as you continue in your medical dosimetry journey because this is the number one rule we live by. We want to make sure that we can go as low as reasonably achievable or a LARA while making sure that we get as much of the cancer as possible. We use advanced treatment planning software and imaging techniques like CT, MRI, and PET scans, and tools to create 3D models and volumes of the treatment area. These are two skills that we do every day called fusion and contouring. Fusion is when we overlay a PET scan, an MRI, or a CT on top of our SIM CT, and this kind of helps the physician visualize the cancer and the tumor a little bit better. And contouring is where we actually delineate and outline all of the surrounding organs in the body. We also collaborate with a lot of different people. We work closely with the radiation oncologists to ensure that treatment plan aligns with the prescribed goals. And we communicate with medical physicists and the radiation therapists to confirm the accuracy of the treatment plans. So while the physician may give us a prescription, we're really the ones that are communicating back and forth and doing this iterative process of um, we know we want to treat to this prescription, but there might be this in the way. What are the limitations that the patient can handle? Have they had prior radiation? So we really kind of make sure that we guard that radiation because, like I said, we can't take back what we give. So we always want to be safe. And we're always talking with the physician, making sure that they're comfortable with the treatment plan. What are they looking for when they're reviewing? So that we make sure that we get that patient the best treatment possible. Our medical physicists and our radiation therapists are amazing individuals. The physicists will help QA our plans, make sure that they're actually deliverable on our machines, while the therapists are actually the ones with the patient every day. So they're there, they're greeting them, and they're treating the plans that we design. Quality assurance. This verifies that treatment plans meet strict and safe effectiveness standards, and we assist in troubleshooting and improvement delivery techniques. So in some institutions, the medical physicist is actually the one that does QA, and others it's the dosimetrist who does their own QA. Assisting in troubleshooting, sometimes the sim therapist will call us and say, hey, this patient's having difficulty, let's say, raising their arm if we're treating their lung. What can we kind of do, or how can we mitigate? What can we do, to make sure that we're not doing something that can harm the patient? We want to make sure that you have as many degrees of freedom to kind of arc around. And they call us to make sure that we're kind of working together collaboratively. And we also improve a lot of our techniques. So let's say a patient comes in and we kind of figure out, let's try this. And we see that it works. We can then go ahead and apply it on a bunch of other different patients that previously we couldn't. So I can tell you that at our institution, we actually treated someone who was deaf and we had to have them hold their breath. So our medical physicist worked with our radiation therapy team and our physician and our dosimetry team, and we actually had almost like virtual like glasses or like a Google glass that you can kind of see someone interpreting breathe in, breathe out while they were getting their treatment. And this is something where we're like, we didn't know we could treat patients, like radiation and now is now something that is available to this population that before we didn't know they had access to. So that's something where I'm really glad to be part of that team. And that's where I say that we are really at the edge of cancer medicine because it's always evolving. Also, you can go into research and education. It's not always, let's say, something that a dosimetrist will do. But when research, they try to advance radiation therapy techniques, improving treatment accuracy, and exploring new technologies. And we also want to become knowledgeable in clinical research, including data, implementing study, and writing papers for publication. And we teach or mentor students and residents and other professionals in dosimetry, radiation therapy, and other related fields. So things like this. where we come to kind of educate other people who may not know what the field is, or maybe they don't even know medical dosimetry exists. It's all about getting the information out there because it is a really cool field. And if you're doing research, our governing body, the AAMD, they have a lot of student writing competitions. They have a conference every year, and you go and you present your research. What have you learned? How can we disseminate this information so other clinics can do it? So, being in New York, we have the we're fortunate enough where we have a bunch of different systems kind of working collaboratively. But there at the conferences, we can kind of see how can we give this knowledge to, let's say, a rural clinic in the Midwest, right? What are they working with? And they're really the ones that are like, how what can you share that with us so that we can do better for our patients? Likewise, sometimes we don't consider things that they see every day, and it's like they're the ones improving. So it is a dynamic where, based on the population that you're in, your research kind of fits that, and you can kind of share it with everyone else in the field. So, what does the process look like? Kind of like what is the day to day? So, a radiation oncologist will usually be the first step. They'll meet with the patient and they'll write a prescription of radiation and define a tumor volume. So, this is kind of where the patient comes in and they're talking with the radiation oncologist. They talk about what disease they have, what are the treatment options, and this is where that term fractionation comes to mind. So, a fraction is how many times that you come in for treatment. So before, patients would come in for, let's say, like a month or 45 fractions, and they would get a small dose. Now, new studies are showing that you can come in for higher doses over a shorter amount of time and still be safe and still be effective at treating the cancer. The radiation therapist and medical dosimetrist then perform a CT scan and acquire anatomical images for treatment planning. So during this appointment, we'll position the patient on our CT table. We'll have molds and we'll create different things to hold the patient in a specific position, and then we'll scan. This scan we then import to our treatment planning software, and we design the plan on this. So this is what it's based on. So this is super important because if the patient can't recreate this position during the time of treatment, they might get treated inaccurately. Or that's why we always make sure that we get them in the most comfortable position because they might be on the table for a long time, or they might come in for a longer number of fractions, and we want to make sure that they stay as stable as possible. Our goals are to create a treatment plan that delivers the highest dose of radiation while minimizing dose to the healthy organs. There it is again. So that's really the core. We want to make sure that we radiate exactly where we need to while cooling off and sparing everything else that we can. The medical dosimetrist is responsible for meeting the prescribed tumor dose while respecting the radiation dose tolerances of nearby organs. Several plans can be reviewed by a physician, but ultimately they're the ones that select the one that they want for treatment. So, like I said, let's say we're treating prostate cancer. We have bladder constraints, we have rectum constraints, there are femoral head constraints. So, we have to keep these in mind, and we can't just blast through everything and say, oh, I have perfect coverage. Sometimes we do have to kind of carve away and spare or work around and kind of manipulate the dose in ways that we can shape it to fit the tumor or the target delineated by the physician while sparing everything else. And this is an iterative process. If we think of somewhere like a head and neck cancer, there's a lot of different organs at risk there. So we're constantly going back and forth with the physicians on, hey, what are like, are we meeting this constraint? Are we not meeting this constraint? Is this something that are you hard on, or is this something that we can have a little bit of flexibility with? And it's not just a one and done. So typically, for those cases, it's a little bit more involved, but ultimately, it's the physician who decides what plan they want to go with. What do we consider while planning? What are the treatment goals? Is this curative or palliative? Is this or is our intention to cure the patient's cancer, or is it to palliate symptoms and kind of give them a better term of life based on the patient's condition? We minimize the potential for treatment side effects, and we look at kind of what we can control. So one thing is erythema, where the skin will kind of get red or it'll start to bubble. That happens when the radiation hotspots are close to the skin. So when our treatment planning, we're always making sure to pull that off if we can. Sometimes there are tumors that are right on the skin, and we kind of have to talk to the physician and see, is this a concern, or is this something that you kind of want to pursue, and just make sure that you get all of the cancer. Medical dosimetrists work closely with the physicist and oncologist to determine the most effective treatment plan, and the physician selects the final plan for treatment. Again, it's just kind of summarizing that this isn't a one person job. Typically, there's a bunch of people working together on one patient. And finally, we prepare that patient for delivery and send it over to the radiation therapist at the machine for treatment. So, how much patient interaction does this field involve? The interaction isn't daily, it's specific to simulation setup, treatment planning scans, treatment setup, troubleshooting issues, and additional calculations and measurement issues. We have to be knowledgeable in patient care, respecting moral, cultural, and ethical issues. And dosimetry has a major impact on patient care by carefully designing the treatment plan, which is best, giving the best chance for survival, decreasing the side effects for radiation treatment. So we're really kind of in the background. Most patients honestly don't even know we exist, but I think in this field, you know that everyone is playing an integral role on their team. So it's not just about one person kind of making the difference. It's about where do we fit along that line and along that patient's journey. So we're there if they call us a simulation. Like I said, sometimes they have issues with setup or they kind of want to try something new, and we're one of the forerunners there. Like how does this work with the treatment planning system? Sometimes they need additional calculations. Let's say during treatment, their body changes, their anatomy changes. They might need a rescan, and we might need to kind of work with the patient, with the therapy team, with the physician again to kind of evaluate what those changes mean for the radiation therapy plan. So it's really, I think, about knowing what type of person you are, like clinically, and then being okay with the fact that like your role, while it might not be at the forefront, is a major role during the patient's journey while they're healing. So, what does a typical day look like for a medical dosimetrist? Our duties include being in the simulation area, treatment planning, it's a T process. We transfer images constantly, whether within our own system or sometimes patients will have priority at a different institution. We need to get those scans and import them. We design our treatment plans. We document their treatment parameters. We supervise the implementation of the initial treatment. We perform dose calculations, work closely with the radiation therapists, physicists, and physicians. We perform chart checks and quality assurance tasks and register images, PET MRI, which these are used to outline normal tissues within our planning system. So, what are educational requirements if you want to become a medical dosimetrist? Dosimetry programs require sometimes that you be a radiation therapist before applying to a dosimetry program, but there are some programs who just need prerequisites. So you can get a bachelor's in medical dosimetry. Prerequisites usually include classes like biology, physics, calculus, trigonometry, chemistry, anatomy and physiology, computer science, and medical terminology. You can usually interview with an admissions committee, but the selection is super competitive. So there's a small amount of programs, but a larger amount of applicants. I think I said last time that there are around 7,000 dosimetrists in the country. I actually looked it up again, and according to the new data that came out from our credentialing body, there's only about 4,900 now in the US. So that's covering all 50 states and internationally. Um, and then we also previously have like if you want, you can shadow a medical dosimetrist, and that is kind of something that programs really like to see because they can see your interest and kind of based on your hours, see how much time you kind of dedicated to the field because it is so niche. A little bit about program information. Currently, there are 18 JCERT accredited programs in the country, 12 certificate programs, 4 bachelor degrees, and 5 master degree programs. So there's 18 in the entire country. And those are for every applicant, I guess, within the 50 states. Some programs do offer more than one type of degree, so they can offer a certificate and a master's, a bachelor's and a certificate. It's kind of a mix. But if you look on the JSTERT website, you can kind of see all the different types of programs, where they're located, and kind of figure out which one's the best for you. Fortunately, distance learning is an option at several of these programs, so you can be in another state studying at a school that offers medical dosimetry, and you have a clinical site close to home. Credentialing information. So, what are our letters? This kind of goes after our names on our white coats. It's CMD, and that stands for Certified Medical Dosimetrist. And graduates of these programs sit for a national board exam to become certified in medical dosimetry. The exam is offered twice a year by the Medical Dosimetry Certification Board. So the MDCB is the one that gives you your credential. JCERT is the one that credentializes the programs that you enroll in to become a medical dosimetrist. Employment outlook, if we look towards the future, the job market is strong. I know with AI, a lot of people might have a little fear and they might say, oh, is there security in a role like this? The answer is absolutely yes. We're not afraid of AI. We're kind of using it to make our profession better and see how it can help us improve, whether that be standardizing treatments around, let's say, different clinical sites within a health system, or running different variable data sets to figure out if we can treat cancer in a new way. Jobs are available in rural and urban settings. So this is something where it's not just isolated to big cities, right? Like I said, you can be in the Midwest, you can be in the South, you can be Northeast, and like in the West coast. So it's really a job that it's needed everywhere, and it's something that you can kind of pick and choose where you want to go ultimately after you graduate. The advancement in technology has increased the demand for medical dosimetrists, and remote work, including local tenant positions, are available through independent visit staffing groups. So there's a lot of different ways for you to get employed after graduation, whether this be at a hospital and a freestanding clinic, an outpatient center, or you can do temporary work or contract positions where you, if you say, I've always wanted to go to Seattle and kind of see if I want to move there, you can kind of do that, get that experience, work there, and see if the full time position is something that you like. So it's very, very cool job, and I think it's somewhere where you can find security. What are typical employers? Well, you can work for private healthcare systems, academic institutions, cancer centers, private practice groups, locum tenens, vendors. Medical dosimetrists are sometimes hired for junior medical physics positions as well. So there's a lot of different people looking to hire medical dosimetrists. So the outlook is very good. What are the average salary ranges? Well, according to the 2023 AAMD salary survey, the starting salaries were between 105, 875,000 to 128, 525,000. The national average is $144,813. The salary, though, may differ by location and is influenced by the amount of experience accumulated over the years. These are like some important links that I'd like to highlight. So the American Association of Medical Dosimetrists, that's our governing body. They have a lot of information for people who want to get started with medical dosimetry, kind of figuring out what it is. A lot of they connect to a lot of the JCERT material, kind of connecting you to programs. They can even connect you with a mentor if this is something that you'd like to pursue, but you don't know where to start. You sign up, send an email, and they'll try to find someone in your area or someone with similar interests so that you can kind of talk to them. The Medical Dosimetry Certification Board, or the MDCB, that's our credentialing body. So you can find a lot of information on the matrix of the exam that we take, what's on it, and kind of figure out how you can best set yourself up for success. And then lastly, the Joint Review Committee on Education and Radiologic Technology. This is the body that certifies the programs that you enroll in to become a medical dosimetrist. So you want to make sure that whatever program you're enrolling in for has that JCERT stamp of approval, so you make sure that you can sit for your MDCB exam. Yeah.
Wow, thank you so
So
much.
any Q&As or anything, I'm happy to answer any questions.
Perfect. That was amazing. So we have some questions. So to start off, just because I know you mentioned how much of a niche sort of specialty this is, and how there aren't
Mhm.
obviously many in the nation with this specific job. So I wanted to know, like, when did you actually know that you wanted to be this specific specialty?
So when I wanted to become a medical dosimetrist.
Hmm.
So for me, it was my senior year at Stony Brook University. So they had announced that the program was actually opening. So it was the first year that this program was going to happen in collaboration with Mount Sinai. And initially, I didn't really know what I wanted to be, I guess, when I started out my journey. I thought about being a nurse, I thought about being a physician. Those were really kind of the only two things I had ever heard about growing up. But through the health professions major, I was able to find out other opportunities in healthcare, whether it be OT, PT, radiologic technician, respiratory therapist, all of these different fields, and I kind of had to figure out where my niche was.
Mm,
I think that senior year, I took a physics class, and that's kind of where I had my aha moment,
yeah.
where I really understood these small things that seem so insignificant had such a huge role to play, I
Mhm.
guess, in someone's cancer journey, right? Because you think about photons, these beams of light, these high energy atoms,
Mm,
they're impacting the human body in ways that we couldn't even begin to understand.
yeah.
And yet I'm sitting in a class and I'm getting it, right? So that's kind of what made me feel kind of like, when when Peter Parker gets bitten by the spider, and it's like, oh, like this is really cool. Like that's exactly how I felt. I was like, this is kind of what I want to do every day.
For
Right?
sure.
And I think I pursued that dream, and it only got better from there. Now we have technology like 3D printing, and we collaborate with a bunch of other institutions. So it's just a bunch of people excited about treating cancer, battling, and making sure that at the end of the day, our patients come first and that they're able to get the treatment they not only deserve, but it's needed.
Yeah, for sure. Okay, and then now because many of us are currently in high school, and I know you previously you mentioned opportunities regarding like the AADC, and then you also mentioned how radiology, anatomy, and radiobiology, these are classes you should take. But currently, like as high school students, are there like any specific classes, programs, or internships that you think if we're considering medical dosimetry, like would you recommend any of it?
Yeah. So definitely, I think at the high school level, I take advantage of the courses that are available at your high school. So for me, I knew like I wanted to go into healthcare, so like AP Bio, AP
Yeah.
Chem, those courses that were available to me, like that's kind of where I got my start.
Mm,
I knew that that could kind of get me a leg up in college because those credits kind of apply, and I kind of prepared myself that way.
mm,
I think what's really cool nowadays is that there's a lot of ways to virtually shadow a dosimetrist.
yeah,
So if you don't have access, let's say, to a hospital near you
mm,
or it's kind of far, maybe there isn't an oncology clinic near you, you can reach out. And more than half of the time, we're really excited to kind of talk about our jobs
yeah,
because we do think it's the coolest thing in the world. So making sure that you have that connection and kind of building that story as to why you want to become a dosimetrist is super important. At the high school level, I think preparing for college, making that big step is kind of what's most important. Look at colleges that offer it. They say, hey, if you want the quickest path, look for those four programs that offer bachelor's degrees in medical dosimetry, right? So there's four schools right now that currently offer that program. Kind of figure out how to get your leg in the door there. Talk to that medical dosimetrist program director. I'd say, hi, I'm a high school student currently here. I've been talking to dosimetrists. I really want to learn about your program. What makes you guys special? So that when you interview, you have that kind of story to tell, and they know you already, right?
okay,
And there's other professions. You can become a radiation therapist first, like kind of figure out if you want to do that, and then maybe if you want to jump into dosimetry if you're unsure, because we aren't really as patient facing. So there are some people who really like that patient interaction. You can become a therapist first, and then kind of move on to becoming a dosimetrist, or vice versa. There are people who flip flop both ways. But really, I think just making sure that you have that solid ground to stand on as you move to college is the most important thing.
for sure. And so, along your journey, what would you say were one of the major challenges that you think you faced?
I think for me, well, I didn't really know what medical dosimetry was.
Mm,
So my senior year, it was just kind of brought up, and it was like, oh, well, our medical dosimetry program is opening. Like, we'd love for you to apply. It was based off of like our classes that we took and our GPA. So I knew it was a little bit competitive, but I didn't really know what I was getting into.
yeah,
I think when I transitioned then, and fortunately I got into the program, I was in a completely different setting. So I was used to kind of college, right? Going to classes, having a schedule laid out, figuring things, having that safe space to kind of make errors, right?
mm,
When I moved to the hospital and they told me, okay, we're going to treat actual patients. I was like, I don't really know. So I had to trust in myself and my academic team that we were doing the best thing possible, right? Not only for my education, but for the patient. That was a constant reminder of us that we're not dealing with phantoms. There are programs that, yes, they'll utilize fake patients or anonymized patient data, but I think having that understanding that you're actually impacting someone's life and you're working with the preceptor and they trust you, like that was a huge step and a huge hurdle. Because I think for me, what I didn't understand, I looked around and I was like, I'm a person of color.
mm,
I didn't really know where I like came from. I was like, did I deserve to be here? Imposter syndrome was so
yeah,
real, but I found so much support in that group of individuals who were my academic team and my preceptors, and they never once made me feel like I was less than. They were always kind of encouraged me to do more and kind of move my potential that I didn't see at the time. And now it's like I want to do the same thing for everyone else and kind of give everyone like a hand up if I can,
mm,
and let them see that there is more out there, that you can be so much more.
wow. All right. And so, to wrap it up with the final question, I was very, excited with the specific story that you mentioned regarding the patient that was deaf and how you guys gave them the glasses. So, just in general, that's like one instance of how already radiation therapy in general is like obviously evolving. But for you, what do you think would is something that you're waiting for to have like to be like more so evolved in the future in this field?
Yeah. So always, I think keeping in contact with our like people who are developing these new machines and new type of modalities is important. So at the conference this year, I kept seeing a lot of things on like MR-Linac, and we have some understanding of it, but being able to kind of test it out. And if you don't know, an MR-Linac uses what a regular Linac does, which is high energy photons beams to treat cancer, but also has MRI kind of embedded on it. So you're able to kind of in real time see patients' organ like shifting and movement and things like that. So when you think of things like pancreatic cancer, that's in the center of the human body, surrounded by stomach, bowel, liver, you have all these things kind of in the way. The pancreas is a very tricky organ to treat, and unfortunately, when most people get diagnosed with pancreatic cancer, it's almost always at a higher level of risk or terminal. So we want to make sure that we're detecting these cancers early and that we're treating them in the most effective and safe way. So by managing that motion and being able to use MR guided images, we're making sure that our treatments are kind of made spot on every single time. Right now, we're using techniques where we tell the patients to hold their breath, or we gate the beam to turn on in a specific portion in their breath.
Mhm.
And while that minimizes the movement, we can't say we're 100% sure.
Yeah,
So using new technology and kind of embedding it, that is like the coolest thing.
yeah,
And then with AI, we can kind of manipulate our plans and generate them in a certain way that's a lot faster and a lot safer for each patient. So we're making sure that everything is kind of working in tandem to push radiation oncology further and
mhm,
push the limits of what we can do. Another interesting story is we had a pianist actually come in, and now we found out that you can use low dose radiation therapy to treat arthritis. So this is someone who loved piano, loved music, loved playing, but because their body was physically unable to kind of move, their bones were breaking down. We used the low dose radiation therapy, and they were actually able to get some movement back. And bringing that joy, bringing that passion back into someone's life, that is the most incredible feeling that I think I have ever felt in my career.
for sure. Well, thank you so much for your time and for all your insight. I'm sure all the students are going to love this. And again, thank you again for your time. And thank you guys for watching.